Greetings, my fellow Coloradans. I want to give you an update today on where we are with COVID-19 announcement about next plans for the vaccination. I'm happy to welcome Brigadier General Scott Sherman, the Director of Unified Central Command Vaccine Joint Task Force for the state of Colorado. As we were beginning to plan vaccine distribution a few months ago, we knew that we needed to bring the right people to spearhead the effort with the right experience to handle the logistics of such a historic undertaking. And that's why we brought General Sherman into the team. He's run logistics for combat operations in Iraq, including ammunition and food for tens of thousands of soldiers. And he's been heading up Colorado's vaccine distribution efforts, coordinating logistics and planning and more. And you'll be hearing from Brigadier General Scott Sherman in a moment. I'm also glad to have Scott Bookman here with us. He's the Incident Commander for COVID-19 at the Director of the Division of Disease Control and Prevention Health Response. Scott has been a critical part of the pandemic response since the early days, and his healthcare background has been very instrumental as we work with all the health partners across the state, community health clinics, hospitals, pharmacies, et cetera. Today we're going to share some updated information on where we are with vaccines and vaccine prioritization. First, I want to give an update on the latest COVID numbers in Colorado. Testing numbers for yesterday, 1,722 new cases out of about 34,000 tests. We are glad to see that testing number go back up into the mid-30s. We feel a lot better about knowing where we're at than we did a few days ago where we had a very low testing number. But 1,722 cases, that's slightly up from the day before. The good news, 596 hospitalizations, which is 48 fewer than yesterday. It's the first time we've been below 600 in a few months. We're very grateful for that. I also want to express my condolences to the friends and family and loved ones of the 5,594 Coloradans who've died with COVID, 4,892 who have died from COVID in our state. And there are, even as we talk about all the bright promise of the vaccine, there are still losses ahead of us, brothers and sisters, mothers and fathers, friends, loved ones. And we have the ability to minimize that by wearing a mask when we're around others, by reducing socializing with people who live outside your home, and by trying to keep a distance of at least 6 feet. We have it in our ability to minimize future loss, even as we talk about the bright horizon with regard to the vaccine. So today, and before I get to the numbers, I want to speak globally about vaccine prioritization. Everybody will have the chance to get this vaccine, and it is free, but everybody can't get it at once. We'll go into the numbers of how many we get each month and each week, and we know a little bit more now about the next few weeks. The reason that we have a difficulty operating more than a few weeks out is we always want to keep the size of the group that we're vaccinating roughly consistent with the level of supply so that people are able to get it over the next few weeks. It was an easy call to say that those age 70 and up should go first, and they are still going. We've done about 40% of people age 70 and up, but there's a lot more to go, and we'll go into those numbers, and we want, our goal is 70% of 70 and up by the end of February. But frankly, we hope that even more than 70% want it, especially among that age group. I'm hopeful that 80-90% of people age 70 and up will want it and have the opportunity to get the vaccine by the end of February. Many have gone already. Some are still signed up and waiting. If you are 70 and up, you have friends or parents or loved ones who are, they will get that in the next few weeks if they haven't gotten it already. Hopefully next week, which will be a very big week for age 70 and up. But we are at the point where we are getting through the 70 and up, and we are looking to expanding eligibility. The most logical expansion is, and one that we are doing, which is going to every Coloradan, every age 65 and up. That aligns with CDC guidance. While a 66-year-old does not have nearly the risk of an 82-year-old or a 90-year-old, they still have a higher risk than a healthy 20 or 30 or 40-year-old. So we want to make sure that we offer that to people aged 65 to 69 starting February 8th. After that relatively easy call, I mean, the easiest call of all is the 70 and up. People 70 and up represent 78% of the fatalities from COVID-19 in our state, and about over 40% of the hospitalizations. So when we succeed in protecting age 70 and up, which we will first dose by the end of February. Many are already even starting their second doses. It ends the crisis phase of the pandemic. Pandemic not over, but no longer, deaths reduced by 3/4, hospitalizations reduced by 40%, no longer up against the overcrowding hospitals. That inherently is big progress. 65 to 69, easy call. We hope to be to age 60 and up in early March. We'll go through those numbers. But there's another group that we believe that is foundational to our society to function, for workplace equity, for the sanity of families with kids, and that is our educators, and first and foremost, our kids' future. And we will be beginning in Colorado to vaccinate all the educators in our state beginning February 8th. That's expected to take 2 or 3 weeks. We will be using about a third to half of the vaccine starting February 8th for about 2 to 3 weeks to be able to vaccinate all the educators, childcare teachers, professionals, paraprofessionals, anybody who's in the classroom with kids. Why is that important? It's important for a number of reasons. First of all, I hope that many parents are appreciative that most of our schools are now back, not all, but most, and they're doing it in a very safe way with layered protections, which we've emphasized from the start. You can do education safely with the right protocols, with the right ways of doing it. Layered protections, meaning one on top of another. If all they were doing was running classrooms like they did last year and the year before, but wore masks, it's better than not wearing masks, but it's not enough for classrooms to be safe. So it's about symptom screening. It's about wearing masks. It's about cohort isolation. It's about social distancing, 3 feet, whatever they can do where possible. It's about ventilation, as simple as an open window where possible. And it's about testing. And we are proud to announce our partnership with Binax, one of only 3 states where we are providing, offering through the districts and charter schools and private schools to provide a test every 5 days for every teacher who wants it in home, as well as an allocation where if there are anybody who's symptomatic, they can do that themselves. But the screening testing is one of the very best protocols for preventing COVID-19. It will afford our public schools and our teachers the level of protection that professional sports teams and others have had as their prerogative through the purchase of 2 million Binax tests a week. We're extending that to teachers starting next week immediately. We're proud to be delivering those directly to homes. But above and beyond that, running public schools are hard because and private schools and all the others, because some of the very protocols that are designed and are very effective in keeping the risk low, namely quarantines, also get in the way of schools operating. And schools go back, but when there's a class out or 2 classes out or a whole school has to go online for 2 weeks, that can also be disruptive. Not just for the kids' education, because we know that many kids need that in person for their academic achievement and for their social emotional health, but also for families. We've seen a startling increase in gender disparities in the workplace and earning, as many second spouses, and often in many cases it's women, drop out of the workplace because there's no school for their kids to go to. And so to prevent those interruptions and the need for the very operationally difficult quarantine protocols that effectively lead to schools shutting down for short periods of time, to recognize and elevate the profession of educators in our society and the cornerstone that our schools of all types provide, we will be able to successfully vaccinate with a highly effective life-saving vaccine every teacher who wants it in public, private, child care settings over a 3-week period beginning February 8th. For those, if you are a teacher or educator and you're wondering how you get it, or paraprofessional, the instructions will come through your district, through your employer, through your school, and you'll have that opportunity with the provider or providers that they work with to be able to sign up and get vaccinated. Members of the general public, age 65 and up, will also have access to the vaccine, along with people 70 and up, beginning February 8th. And they can sign up with a provider near them. There is no need, if you are 65 and up, you can sign up now, but it doesn't mean you go any earlier than if you wait until February 7th or 8th. They won't start until February 8th, and it will be randomized in terms of who gets them. So try to keep those phones clear for people 70 and up, because they are our focus here as we'll get into the numbers through February 8th. Now, how do we get there? How do we know that this will work with the right vaccines at the right time for the right group? How do we know we can get through the teachers without delaying the 70 and up, the 65 and up? How do we reach our goal of 70% of people aged 70 and up successfully protected by February 28th? That's what we're going to show you now. A lot of thought and analysis went into this process over the last few days, and the only reason we're able to be here and present this is because we have visibility into the next 3 weeks of vaccine supply. That was one of the early accomplishments of the Biden administration, is we finally have a sense of what we're going to get so we can plan out a little bit more. There's some planning for the early March timeframe, but again, that's going to depend on quantity. It's still a little nebulous. We're going to have to further hone it. But for now, we're comfortable in talking about where we are for the next few weeks so Coloradans can plan accordingly. As I've said many times, the COVID-19 vaccine is our path back to the Colorado we know and love. And from the onset, we've approached vaccine distribution in a way that's equitable, saves the most lives, and ends the pandemic as soon as possible. This Herculean effort to get vaccines into arms cannot be underestimated, and I'm proud that Colorado remains among the top states in successfully deploying the vaccine. And it's one of the very reasons I put General Sherman in charge of this effort. And I want to thank General Sherman, his entire team at COVID Response, and the folks at CDPHE who are going above and beyond. I also want to thank our local public health professionals for their critical work in a very challenging time. Before we even received the first dose of Pfizer back in mid-December, we've been planning and preparing for that day. And today, Colorado is one of the top states in the country in successfully getting the vaccine into arms. But this process, of course, has not been perfect. It's not about perfection. It's about getting it done, saving lives, ending the pandemic. Here in Colorado, we're doing everything we can to win the race against time, the race against the virus and its more contagious variants. And now we're ready to take the next step. I'm incredibly proud to say that 90% of our highest risk frontline healthcare workers have received both doses of their vaccine. That's essentially all who want it. We're happy with the 90% number. I hope that we get to 90% of 70 and up that want it. We expect that among the general population, it'll be more in that 70% range. But of course, healthcare workers who understand the science, who know what the vaccine does and how it protects them, I'm very thrilled that 90% have taken advantage of the opportunity and have now completed both their doses and are either protected now or shortly will be protected in the next week or two. They're on the ground. They work in COVID wards, under 600 hospitalizations. That's still a lot of people in the hospital from COVID. 100% of our skilled nursing facilities have received their first dose. 71% have received their second dose. I heard from a grateful 88-year-old friend who lives in a nursing facility who just received her second dose. And is very excited that within a couple weeks she'll be able to visit and see her friends and really end the social isolation that's made it very, very difficult. And we appreciate all the different burdens that people have faced. For some, it's the health burden. They've gotten sick. They've lost loved ones. For some, it's the economic burden. Their job's been impacted. And for some, it's the social, emotional burden, especially our seniors. This means, given where we are with skilled nursing facilities and frontline workers, we are essentially moving full speed ahead with 70 and older. That is our focus right now. We set the goal of ambitious goal of protecting at least 70% of people 70 and up by the end of February. And why? It's 78% of the deaths and 40% of the hospitalizations in our state. There's about 562,000 people aged 70 and up in Colorado. If we target 70%, it means 393,639 to be precise. Now, again, we hope it's more. We hope that 80-90%, like healthcare workers, of people 70 and up will choose to get the vaccine. But we know there'll be some stragglers and a few that aren't willing to go out of their way to get it. So we'll be happy to celebrate achieving 70%. We're going to keep going from there. We've currently vaccinated 190,995 Coloradans aged 70 up, which means that we're just under halfway to our goal. Today, we should be, with the vaccinations from today, we should be halfway to our goal of protecting people 70 and up. And I know there's people 70 and up watching this who got it, of course, who had friends who got it. There's also some watching this who signed up or haven't been called yet. And you will. It could be next week. It could be the week after. You will get the chance to get the vaccine if you're 70 and up in the next few weeks. And many of you will next week. And these numbers don't even include the residents of the long-term care facilities and nursing homes. So there's actually even more people aged 70 and up that got it, but we deal with it as a separate category. We continue to have a laser-like focus on the goal of protecting 70% of Coloradans aged 70 and up by February 28th ending the crisis phase of the pandemic, reducing deaths by 75%, reducing hospitalizations by more than 40%. During that time, we will also be able to cover many of the people aged 65 and up, and also ensure that our schools are able to continue uninterrupted. I'll now turn it over to General Sherman to go into more detail about exactly how we are going to make achieving this goal a reality in Colorado. General Sherman.
Thank you, Governor. Next slide, please. Good afternoon, ladies and gentlemen. This chart shows our best estimate for what the weekly allocations from the federal government will look like moving forward. This is a fairly conservative estimate, and there is potential for the numbers to be higher. We do not anticipate the supply chain to diminish forward. We've been very thoughtful on this supply, and we've researched it thoroughly. We're very confident in these numbers that we'll receive through the end of February. This estimate does include the 16% increase through the end of February that the Biden administration announced. And for the week of February 1st through February 8th, next week, that also includes an increase of vaccine that was returned back to Colorado from both CVS and Walgreens from the federal long-term care facility program. There was extra doses they did not need, and they're returning it back to Colorado so we can make sure that we get those shots into our population. So given these projected numbers, we estimate that we'll receive roughly 452,000 doses between now and March 1st. But I want to make sure that everybody keeps that in context. Colorado is a state of nearly 6 million people, so it's going to take time, and please ask everybody to be patient before we can expand access to the general public. Next slide. So this last slide I showed was the total estimated allocation of vaccines that Colorado would receive. And this slide shows the number of those vaccines that will be utilized for Coloradans 70 and older. Given these numbers, we're confident we'll be able to vaccinate enough Coloradans each week to reach our goal. The goal right there at the bottom that the governor mentioned, 393,639 doses. So we estimate there's 562,000 Coloradans over age 70 that aren't in long-term care facilities. And we certainly think with this allocation that we're getting through the end of the month that we can reach that goal and also start teachers and our 65 to 69-year-olds here after 8 February. Governor, I'll turn it back to you.
Thank you, General Sherman. And from the beginning, I've said that we would make real-time decisions based on the latest data, facts, science available now, knowing the number of vaccines we'll get for the next 3 weeks. And based on this information, we are very confident that in these changes that we're making to Phase 1B. Phase 1B subdivided. Now, of course, Phase 1B1, which is where we are right now, including Coloradans 70 and older. Phase 1B2, which is where our state will move into February 8th, includes every Coloradan aged 65 to 69, as well as continuing with those 70 and up who haven't been vaccinated yet, as well as all preschool through 12th grade educators and licensed child care workers to ensure that they can continue uninterrupted. Phase 1B3 includes frontline essential workers and Coloradans who are age 16 to 64 but have 2 or more high-risk conditions that are medically indicated to correlate with CDC criteria to substantially greater risk. We also, in Phase 2, expect that we will soon, in early March, be expanding eligibility to the general public 60 to 64. So working our way down, 70 and up done by that point, early March, 65 to 69 done, and then available for everybody 60 and up, as well as Coloradans with high-risk conditions. We're hopeful that that will begin soon. Phase 3, of course, the general public, we hope early summer, could be late spring. There's really very little I can offer in that regard in timing because it simply depends on quantity. As soon as we are able to, of course, we want to get this out to as many members of the general public as possible. But there are a lot of folks in the essential worker groups who have priority. What does that mean? It's those who work in an environment where they have no alternative but to go in, right? Your grocery store workers, your bus drivers, very important that they have priority. There are other Coloradans who have the opportunity to work from home and are members of the general public, and they will be able to get the vaccine, but we want to protect those who have no choice but to go in to work first, as well as expanding the general population eligibility to age 60 and up. To go over these updated phases in more detail, I'm happy to turn it over to Scott Bookman. Scott?
Thank you, Governor, and thank you, everybody, for joining today. I want to take the opportunity to run you through a bit more detail on our updated phasing. Here, you'll see detail on Phase 1B2, which now includes people age 65 to 69, our pre-K through 12 educators, childcare workers, and those who are critical to the continuity of state government. I want to particularly call out in the educator group that this is not just childcare workers and teachers. This is also bus drivers, paraprofessionals, safety workers, and other support services that are critical to the functioning of our schools each and every day. Next slide, please. So, in Phase 1B2, we estimate that there are a total of 408,000 people. That is 288,000 65 to 69-year-olds, approximately 120,000 PK through 12 educators and childcare workers in licensed programs, and then approximately 100 continuity of state government workers. Next slide. So, our goal is to vaccinate 55% of 1B2 by March 5th. And so we will begin on February 8th, and our 65 to 69-year-olds and our educators will be included and eligible to start receiving the vaccine. And based on the numbers that we have available to us today, we believe we will hit that goal by March 5th. Next slide. So we know that people are struggling from time to time to figure out how to sign up for the vaccine. So I want to take the opportunity today to be clear about how we want people to do this as we move lower into our phasing. So 65 to 69-year-olds should follow the path of our 70 and up. Sign up with your local provider to schedule an appointment. You can get more information on how to do that by going to our website or calling our hotline. That information is on the screen in front of you. Next slide. For those who are eligible to receive vaccine in Phase 1B2, you will sign up via your employer. And so rather than getting in touch with a provider directly, we encourage all PK through 12 and childcare workers to contact their employer to figure out how they will be vaccinated. At this point, many of our school districts and other educators have already partnered with providers and are planning to deliver vaccine to their employees. Anybody who has not been able to do that at this point should reach out to their local public health agency or a healthcare provider to start doing that work. And again, that is the educational institution that should begin doing that, not the individual employees in those facilities. Next slide. So many of our largest school districts are already undertaking that work. We know that Denver Public Schools has formed a relationship with Children's Hospital. We know that the Aurora Public Schools are working with Kaiser Permanente, Centura, and Salud to get their educators vaccinated. And we have heard that Jefferson County is working with Centura, SEL Health, and Children's. So a lot of work has already been done in this area. And again, we want to encourage educators to work with their employer, not with the provider directly. Next slide. So moving on to Phase 1B3, this is frontline essential workers and Coloradans who are 16 to 64 with 2 or more comorbidities. So when we talk about frontline essential workers, as the governor indicated, these are people who have to go into work to do their job and are essential to the functioning of our society. For example, these are food and agriculture workers, U.S. Postal Service, public transport, public health workers, frontline essential human services, faith leaders, and direct care providers for Coloradans experiencing homelessness. Also looking at people who are 16 to 64 with 2 or more high-risk conditions as identified by the CDC. Some of these conditions include chronic kidney disease, COPD, Down syndrome, sickle cell disease, and also people with disabilities that prevent them from wearing masks. Next slide. 1B3 is a large group. We currently estimate that there are over 1.1 million Coloradans in this group. That includes 750,000 essential frontline workers, and then approximately 400,000 people who are between 16 and 64 who have 2 or more comorbidities. Next slide. Our goal is to start vaccinating Coloradans in Phase 1B3 by early March. We currently estimate that date to be March 5th. That is dependent on supply and the ability to get vaccine administered as quickly as we can. More information will follow as we move through Phase 1B2. Next slide. So, for frontline essential workers and Coloradans with two or more comorbidities, there are two paths to sign up here. If you are a frontline essential worker, we would have you do this in the same way that our educators will do. So work with your employer to ensure that you have access to a provider who is able to give you the vaccine. And we are continuing to work with stakeholders to ensure that those who do not already have a relationship with a provider, we will facilitate that happening. For Coloradans with two or more comorbidities, we do anticipate that they will be handled in the same way that our 65 to 69-year-olds and our 70+. More information to follow there. Next slide. Governor, I'll turn it back over to you.
Thank you, Scott. And I want to make something clear. Of course, we want to reach and would love to reach 100% of these target groups. We would love if 100% of people aged 70 and up and 65 to 69 and teachers receive the vaccine. We're happy with the numbers of 90% of healthcare workers, and that's probably a high watermark. For many other groups, it'll probably be in the 70-80% range. But we plan based on the reality and the likely scenarios. And so by setting the goal of reaching 55% of the target group by early March, we then want to open eligibility for the next round, or we risk then slowing down the administration of the vaccine, because once you're at around 55%, as we're getting very close to a 70 and up, sure, there continues to be a reduced trickle of those for a few weeks, but you really need to open it up to the next group to ensure that you're not slowing down the utilization of the vaccine. Of course, our top priority, getting it into arms, working with our providers within 3 days of when they receive it. So we're working to manage supply and demand. We have visibility on where we are, certainly for February. I think that March is likely to be updated again in terms of the exact date and pool, but we gave you some general parameters about our early thoughts, and that'll be informed by actual number of vaccines that we receive. The trouble that many other states have run into has been a very rigid vaccination system, meaning they have they would wait to, if a state would wait till everybody 70 and up was done, in that last week or two of 70 and up, you have a lot of vaccine being unused because you're trying to find the smaller, the members that are left of a smaller and smaller group. If you're 70 and up, you're going to get it in the next week or two, and it doesn't mean there won't be a few stragglers that maybe were on no list or the wrong list through late February, but most of you are going to get it in the next week or two. Teachers, educators, just because we have that February 8th date doesn't mean that, February 9th, everybody's going to get it. It's over a 3-week period that every educator will get that, and many of them in 2-week period, but we're really, for the quantity of the vaccine, it'll take about a 3-week period where you'll have the opportunity to do that. To summarize, we've completed vaccinations for phase 1A. It's not possible to reach 100%. We're at 90%. We're happy with that. Highest risk healthcare workers have received the vaccine. I want to point out that if you're someone who should have been eligible under 1A and you change your mind, you still want it, doesn't mean you're out. You can still get it. If that 90% increases to 91 or 92%, that's wonderful. So you might have been out of town or sick, or maybe there might be good reasons, like you just got over COVID and you want to wait a month or two till you get it. You're still eligible. We're also well on our way to reaching our goals for phase 1B2, the top priority to save lives, people over 70. We're confident that anybody who wants it over 70 will have that opportunity by the end of February, and we're hopeful that that's over 70%. I think it will be, and we would love, especially for those over 70, we'd love to reach 80 or 90%. That might take a few more weeks for those who want to wait a little bit, but hitting that 70% is critical, and we'd love to go higher. And I'm very excited that starting February 8th, across Colorado, everybody age 65 and up will be able to receive the vaccine. It is free. You can receive it locally. Your number might not come up the day after you sign up, but you will have it, whether it's a week or 2 or 3. If you're 65 and up, I have a high degree of confidence in saying that you'll be able to receive the vaccine during February, no matter where you live in our state, as well as making sure that we protect our education heroes, our preschool through 12th grade educators and early childhood providers, whom are so critical for the successful function of our society, for workplace equity, for families who have to work, for the future of the kids. It's so important that we facilitate the return to in-person education, just as we have with providing millions of free medical grade masks to schools, Binax testing to schools where every teacher can be tested once every 5 days on a cadence recommended by the CDC, the thoughtful protocols developed around cohort protection and ventilation and distancing, and now to prevent interruptions necessitated from quarantines and provide that additional level of protection, vaccination. In early March, March 5th, but we hope, I'm optimist, always hope it's earlier, but that, if we don't get any different news, March 5th, around there, frontline essential workers, Coloradans aged 16 to 64, 2 or more high-risk conditions. Around that date, every Coloradan aged 60 and up. We'll have more information on that. It really just depends on vaccines. I think there's 2 errors here that some states have made. Some, as I mentioned, define the eligibility group too narrowly, slowed down their vaccines, they're sitting on shelves. Other states have opened it up too quickly, which is probably not as bad a problem as being too narrow, but it's very frustrating for people because the list is so big that it feels like nobody's getting it, even though they are getting the vaccine out, and people would wait many, many months. We hope that by doing it this way, nobody who's up has to wait more than a few weeks. If you're 70 and up, you'll get it in February. If you're 65 and up, you'll get it in February. If you're a teacher, you'll get it in February, rather than lead on people who won't get it in February by saying that they're now up when they're sort of de facto not. So we're trying to align this in a way where if it's your turn, and by the way, when it is your turn, get the vaccine. Don't feel guilty. Don't feel you're not worthy. You are. We need to get it to you to protect you. Get the vaccine when you're up. And hopefully when you are up by nature of your age or your employer, you'll be in a few week period that you'll be able to be successfully vaccinated. Anyone looking for more information can visit covid19.colorado.gov, covidvaccine.org, covidvaccine.org. We have a toll-free number, English, y Español, 877-CO-VAX-CO. And at either of those resources, you can find how to sign up, to be on a wait list. I want to reiterate, if you're 65 to 69, you sign up just like our friends over 70, sign up at a hospital or community health clinic near you, and you will have the opportunity in the next few weeks to get it. The numbers aren't such that if you're 66 years old, you won't be able to get it February 9th for sure, right? There's a 3-week period through February that you will be able to get the vaccine. Some will get it February 9th, some will get it February 27th. It will be randomized. There's not preference based on who your provider is or who your insurance is. Everybody's equal access. And you will have the opportunity to get the vaccine. For our pre-K and kindergarten through 12th grade educators and staff, work with your employers. You do not sign up on one of these public sites. You will have a link that will be from your employer to sign that up. As a subgroup, it'll be up to the employer which providers they work with and how you sign up. So it'll be different in each district. So just stay tuned. Expect that email. In or around February 8th to be able to schedule that, and know that also means for you. It means sometime in the next 3 weeks you'll be able to get that. Most in 2 weeks, some in 3. And please, this message is for everybody eligible to receive the vaccine. If you have an appointment, show up and get it, please. They'll use the vaccine, but it might go to a lower priority group. Show up for your appointment, and also the converse of that. Don't just show up if you don't have an appointment. They're not taking walk-ins. There's more demand than supply. We get that. Sign up if you're in the eligible group. You'll get it very soon. And taking walk-ins, our partners wanted me to pass along. It puts a burden on them because they don't like to be in the position where A, extra people are sort of loitering around, and B, they have to tell you no, we don't have it. So wait till you're up, and then do show up, and make sure you have that appointment. Colorado, this is the big next step. Since we're at about half of the goal for 70 and up, we're ready to announce on February 8th. We're moving on to be able to get anybody age 65 and up vaccinated, along with our teachers and educators that so many of us rely on for our kids' future and for our work today. Since the early days of this pandemic, our decisions are driven by data and the best information we have. Any of these are subject to change if there's additional or different information we get about the number of vaccines that we will be receiving in a different week, and today's announcement is no different. Every vaccine administered is one step closer to ending the pandemic. And I want to thank General Sherman and Scott Bookman for joining us here today, and I'm happy to open it up for questions.
Hey, Governor, this is Seth with the Gazette. 2 questions for you. First, if workers in homeless shelters are going to be included in the next phase, why doesn't that include people experiencing homelessness, which is something Denver wants to do? And second, The CDC has said that correction staff and inmates should be vaccinated at the same time because of their shared risk, which most of the states are doing. Why is Colorado not doing that? Thank you.
So, yes, everybody who is experiencing homelessness who's over age 70 is currently eligible, has hopefully been vaccinated. On February 8th, that will expand to people age 65 and up experiencing homelessness. And it is the same with our prison population. Every prisoner age 70 and up has been vaccinated. We have 573 inmates that are age 65 and older, and they will all be vaccinated right after it opens up February 8th to them. We believe on the risk-based criteria for saving lives, and that's why we've prioritized and are leading many states in protecting our most vulnerable, age 70 and up. And if you're 70 and up, it doesn't matter if you're a millionaire or you're homeless or somewhere in between. You are at greater risk simply because of your age. And that goes the same for, again, whether you're in prison or whether you're on the outside or whether you are healthy or not. Age itself is a risk factor. And we're all going to breathe easier when we've successfully completed the vaccination of people aged 70 and up, because it represents 78% of the fatalities from COVID in our state.